Hi, today we're going to be doing a vital signs demonstration. We're going to be working today with a general med-surg patient. We know that this will look a little different depending on where you're going to be working. You'll learn those variations with your preceptors. But for this week in ClinTech Academy, we're going to be working with this scenario that we're about to do. So my name is Jillian. I'm going to be the ClinTech. First thing I'm going to do is get delegation from the nurse.
Hi, Jillian. How are you?
Fine, thanks.
We have this patient, Jean Gray. She just got here, and I was wondering if you could do an initial set of vital signs for me.
Sure.
She's in room 200.
Okay, I'll get right on that. So I'm going to come into the room, foam in as I enter.
Hello, come in.
Hi, my name is Jillian. I'm the tech that will be working with you today. I'm going to be here till 7 tonight. How are you?
I'm good, thanks. How are you?
Good, thanks. First thing I want to do is just make sure that I'm in the right room. Can you tell me your name and date of birth?
Sure, it's Jean Gray, 12/1/1964.
Okay, if you don't mind, I'm going to take a look at your armband. Jean Gray, 12/1/64. That's you. I'm here to take a set of vital signs. It's going to take about 20 minutes. Is now a good time?
Yeah, no, it's fine.
Okay. I just want to take a look at the armbands that you have here. I see you have a limb alert. Let's talk about that. I have a couple questions for you.
Oh, sure.
Do you have a fistula?
Fistula.
That's
I'm
for
not sure.
dialysis.
Oh,
do you get
okay.
dialysis?
No, I do not.
Okay. Do you have a PICC line?
I'm not sure what that is.
Okay, let me take a look. It's a special IV and it goes from your arm all the way to the heart, so not like a regular IV.
Oh, no, I don't think I have that.
I don't see one. I think we're good with that. Next one is, do you have a blood clot in either of your upper arms?
No, I don't.
Okay. And have you ever had any lymph nodes removed?
Yes, I have.
You have. Okay, which side would that be on?
Right here.
Your right side. Okay, so that's why you have this limb alert band. So we'll be sure to do your blood pressure on your left arm.
Okay.
And then I also see you have a fall alert band. Has anyone talked to you about that?
No, I haven't really heard about that one.
Okay, we'll talk about that when we get to the board in a little bit, but it's just making sure that you're safe while you're here. So we'll talk about that in a little bit, okay? So for your vital signs, if you don't mind, I'm going to take your manual pulse first.
Okay.
And I'll be doing that on the radial pulse. It's on the thumb side. We're going to be using 2 or 3 fingers, and you want to get a nice deep feel, and we're going to do that for a full minute. So, if you don't mind, I'm going to put my fingers here on your wrist. Make sure that you lay their arm down. It's uncomfortable for them to have to hold it for a minute. And I'm going to time a full minute on the watch. In reality, for the sake of this demonstration, we'll say that that was a full minute. And I'm going to count every beat. Once I get that, I'm going to write my number down. And then, do you mind if I double check that? Just want to make sure I have an accurate
Oh,
reading.
sure, that's fine.
I'm going to go into a full minute of respirations, but I'm not going to let my patient know because I don't want her breathing weird. So I'm going to do a full minute of respirations while she thinks I'm measuring her pulse. One respiration is an inhalation and an exhalation. So I'm looking at her chest, her shoulders, feeling her back to get a good accurate count. Again, for a full minute, for the sake of this scenario, we'll say that that was 60 seconds. Okay, thank you very much. I'm going to write this down. And I'm going to get my machine going here. Okay, so first thing it's asking me to do is sign in. This will be your badge once you have one. We have this card here. You're going to use the lower barcode, and that's going to pull up your 5 and 2. I'm going to hit sign in. I'm going to select spot. This means I'm taking a single set of vital signs. Then it's asking me to scan the patient's ID. Do you mind if I scan your ID band here? Okay. It's saying unable to identify patient because she is not a real patient. In reality, your patient's first and last name would be right here. Okay, so we're going to check your blood pressure, your oxygen, and your heart rate. Let's go ahead and start with your blood pressure. We have different sizes of cuffs. The way to size them, we have index lines here, and then, or the range here, and then we have the index line here. When this wraps around your patient's arm, the index line has to fall within the range. If it doesn't, you'll get a false high or low on her blood pressure reading. The other thing that you want to watch for is the artery arrow. This lines up on the inside of the elbow, and that's going to allow us to get an accurate reading. The patient should have their own cuff that stays in the room. These don't move room to room with the machines. Okay, so again, we're going to be using your left arm to check your blood pressure. If you don't mind raising that up for me. Sorry, my hands are cold.
That's okay.
And I'm going to wrap this around. And I'm going to hook it up to the machine.
Okay.
Miss Gray, would you mind uncrossing your legs for me and having your feet
Sure.
flat on the floor? We want to just make sure to get the most accurate blood pressure. Here in the middle, there's a little gray silhouette with start. I'm going to push that. You're going to feel the cuff getting tight on your arm. Okay. Next thing I'm going to do is check your temperature. Have you had anything to eat or drink in the last 10, 15 minutes?
I have not.
You haven't, okay. Okay, I can hold this for you, or you could hold it.
Oh, sure, I can hold it.
Okay, right under your tongue, don't bite it. Okay, thank you. And then we're gonna check your oxygen level. Can I see a finger, please?
Sure.
And this can be on either hand, even though she has a limb alert, that's just for blood pressure. Go ahead and rest your hand down. And I'll take off your blood pressure cuff while that's running. So again, the cuff stays in the room. So we unhook it from the machine. Okay, I'll take that from you. Thank you very much. So we have your blood pressure. It's 149/90. Is that about normal for you? Where you
Yeah,
are?
that's
Okay.
about my normal.
Your heart rate is 89. Your oxygen level is 100%. And your temperature is 98. Now, if the machine is reading 89 for her pulse, and I had gotten something wildly different when I did the manual pulse, then I would recheck and I would let the nurse know both of those numbers, both what I had gotten manually and what the machine was reading. Okay, so the one measurement that the machine does not read that we need to enter is the respiratory rate. Down here in the corner, RR, I got a respiratory rate of 12. And then I'm going to hit modifiers, and that's going to allow me to add in some extra information about this patient that will be documented in her chart. So her blood pressure we took in the left arm. The position that she was in is sitting, and she was not on any oxygen, so I select none. Then okay. If she was a real patient, save would now be highlighted. I would hit that, and that's what's going to upload this data into her chart. And then I want to make sure I have everything written down, and then I'm going to sign out. I can do that either by tapping my name up here or the power button, and that will take me to sign out. Okay. If this machine is going to move room to room, I'm going to make sure to wipe it down. Okay, and then some hand hygiene. Then we're going to move into our P's and Q's and finishing up this scenario. So, Miss Gray, I should have asked you at the beginning, how do you prefer to be addressed?
Oh, Jean is fine.
Okay, Jean, has anyone talked to you about the board?
No, not yet.
All right, so this has all the information about your stay so we can all be on the same page. First thing is you're in room 200. This phone number here is the number to your bedside phone. So if you would like to give this out to any friends and family, they can call you using this number here.
Okay.
Today is Wednesday, March 20th, 2024. This here is your care team. These are the people you're going to be seeing in this shift today. So Lynn Ann is your nurse. She got you settled in when you first arrived. Her number is 1231. My name is Jillian. Again, I'll be here till 7 tonight. My number is 1232. Anything that you need, please don't hesitate to call me. Have you used the phones here before?
I have not.
Let's practice just to make sure that that it's working. So go ahead and pick up your phone.
Sure.
You're going to dial 1232. Yep, and that goes right to my bedside phone.
Great.
So you can either do that or just push the call bell. Either way, we'll get somebody in here to help you out. Nancy is our charge nurse today. She's supervisor of the unit for the day. She'll be popping in at least once just to make sure that everything's going well with your stay. If you have any questions for her, 1233 is her number, but reach out to myself or Lynn Ann first for anything that you might need. It says here your family contact is Sophie. Is that accurate?
Yeah, she's my sister.
Okay, and is this a good phone number for her?
Yeah, that looks correct.
Okay. Your doctor is Dr. Alexander. If you've not seen him yet today, he will be coming around at some point. I don't know what time, but he'll be popping in.
Great.
And your case manager is Sue. Sue, you most likely won't see today. She's in charge of all of your discharge needs, so that'll be more towards the end of your stay. We want to make sure everything's set for you when you'll be leaving us.
Okay.
For special needs here, I see you have glasses. Did you bring those with you?
Yeah, I think they're on my bedside table over
Okay,
there.
yep, I see those right there. And you use a walker to get around. Did you bring that with you?
I do, but I don't see it anywhere.
Okay, let me check. It's in the bathroom behind the door. So we're gonna leave it in there because we talked about that you're that high fall risk. We wanna make sure you're not getting up on your own. So if you need to get up to go to the bathroom at all, you're gonna be calling me or calling Lynn Ann, and we'll get that walker out and help you move where you need to move, okay?
Okay.
And then again, we've got that limb alert on your right arm. So your plan for today, you have wound care, you're gonna get some antibiotics, and we do have physical therapy coming in. I don't have a time on that yet. And then we're gonna move on to pain. Do you have any pain right now?
I do.
You do, okay. If 0 was no pain, 10 being the worst pain ever, what number would you give your pain?
Probably about a 6.
A 6, okay.
Yeah.
And where is that pain?
In my hip.
In your hip, which side?
The right hip.
Your right hip, okay.
Where that wound is.
Okay. Can I help you adjust at all your position? Would that help out with that?
Oh, maybe an extra pillow would be nice.
An extra pillow, okay. So I see you don't have an extra one in here. I'll bring one in for you.
Great.
All
Thank you.
right. And then again, that high fall risk, that just means please make sure you're calling me and not getting up on your own. Do you need to use the bathroom while I'm in here?
No, not right now. Thank you.
Don't, okay. And I see you don't have an IV pump right now. Is there anything I can get for you? Can you move closer?
Yeah, I'd love to have my coffee.
Okay, let me move this right up here for you. Watch your toes.
Oh, that's wonderful. Thank you.
Okay, so we've got your glasses, your phone, your coffee. Anything else that you need?
I don't think so.
Okay. Is it quiet enough in here for you?
Yeah, it's fine.
Okay, and you can adjust the lights and all that on that call bell you've got right there next to you. Do you have any questions for me?
Would it be possible to get some pain medication?
I will talk to your nurse about that. It looks like your next dose is due at noon, but I am going to let Lynn Ann know that you're asking, and she can come talk to you about that.
Okay, great.
Okay.
Thank you.
Someone will be back in about an hour. We do hourly rounds. But again, if you need us before then, please do make sure that you call. So we're here to keep you safe and help you getting up and about.
Okay.
All right? Okay, thank you.
Thank you.
I'm gonna do my hand hygiene on the way out, and then I'm gonna come back and report to my nurse how Jean Gray is doing.
Hi, Jillian. How'd it go with Jean Gray?
Great. Her vital signs look good. Her pulse is 89. Her respiratory rate is 12. Her blood pressure is 149/90. Her oxygen level is 100%, and her temperature is 98. She did say she's having a level 6 pain, and that's in her right hip, in her wound.
Okay.
And she was asking for some pain medication.
Yeah, I'll see what's
So-
available. Yep.
Okay. And then I'm going to grab her an extra pillow and get that back to her.
All right.
Thank you.